Good afternoon and Assalamualaikum. My name is Nur Atiqah Noordeen, and today I will presenting my research proposal entitled Knowledge and Practice regarding needle stick and sharp injuries among nurses in a private hospital. So without further ado, let's move on to the outline. So at the end of this presentation, I will able to explain regarding, I will cover mostly regarding introduction, problem statement, research hypothesis, research objective, significance of this study, literature review, understand underlying theory regarding this study, methodology, sample size that will be used to calculate the sample population in the study, data collection process, and as well as references. So for the background, needle stick and sharp injuries is categorized as one of the occupational hazards that can accidentally occur within various sectors, but especially it will occur in the healthcare settings. Approximately 35.7 million of healthcare workers are exposed with the NSSI, and approximately 10% of the nurses experience HIV, hepatitis B, and hepatitis D due to NSSI. NSSI is the injury that any action that occur penetration of sharp object of needle, blade, broken glasses, or other sharp devices into the patient's skin that can result in the blood-borne pathogen transmission, which is commonly transmission of the hepatitis B, hepatitis C, and also HIV. So the problem that I found before I start my study is needle stick and sharp injuries are one of the occupational hazards that commonly will occur in any healthcare setting. This is due to the healthcare workers' poor of knowledge and also poor practice, especially among nurses, which are nurses are unaware regarding the effect and consequences that may occur after the exposure and did not know what to do and whom to refer after the exposure. This is stated in the study done by Alam in 2002. Apart from that, inappropriate disposal of needle also found in many studies, which is nurses are unable to discard the sharp needle into the sharp bin, but despite of that, they discard the needle into the general waste, which resulted in the penetration of the needle for other staff and also other healthcare support service like cleaner or housekeeping. Recapping and also unaware to use personal protective equipment (PPE) also one of the factors that commonly will result in NSSIs. So the research hypothesis in this study is there is no significant relationship between social demographic, which include age, gender, education level, and year of service, with knowledge and also practice of the needle stick and sharp injuries among nurses in a private hospital. Another one is there is no significant relationship between knowledge and practice regarding needle and sharp injuries among nurses. So the research objective for the general objective is to determine the knowledge and practice of NSSI among nurses in a private hospital, and the specific objectives are to determine social demographic characteristics such as age, gender, education level, and year of services among nurses in a private hospital, to identify the level of knowledge and also practice regarding NSSI among nurses, to determine the relationship between social demographic characteristic and knowledge and practice of NSSI, as well as to determine the association between knowledge and practice among nurses regarding NSSI. So the significance of this study is to identify the level of knowledge and practice, which in this study, the data that collected within this study can be used for the further investigation of others' research, and as well as to investigate and introduce new intervention to minimize the exposure related to this type of occupational hazard, as well as to develop new control measures. So we move on to the literature review. there's a lot of various databases that are found regarding this topic. And regarding to social demographic, which is age, Gupta et al. In 2019 stated that highest rate of NSSI was found among age group between 20 to 39 years old of nurses, while this percentage of prevalence of NSSI was found among age group of 40. For gender, Ng and Hassim in 2007 stated that male respondents have higher prevalence of NSI compared to female. However, they stated that there is no significant association between genders and neither stick injuries in their study. For education level, nurses with higher educational qualification have a chances to experience NSSI. This is stated in Saravanan et al. In 2014. And the year of services, Gupta et al. 2019 stated that NSSI commonly occur maximally for nurses that have experience less than 1 year old, mostly during venifunction of needle, recapping and suturing. Next is the needle stick and sharp injuries. There's a various of articles that found. One of them is the Gupta et al. 2019 stated that nurses score higher percentage compared to healthcare workers in the tertiary hospital. For knowledge, Zia et al. 2017 stated that nurses have poor level of knowledge regarding NSSI. Dasgupta and Dasgupta 2019 stated that main percentage of knowledge scored among staff nurses were low due to lack of awareness. For the practice, Alwap 2018 stated that majority of the nurses have poor practice and they have low level of practice in handling needle and sharp, that resulted to high occurrence of the injuries. So the underlying theory in this study, which is the KAP model and the health belief model. For the KAP model, in this study, in this study, I want to investigate between the relationship between the knowledge and practice among nurses. So I will use KAP model as presented by Schwartz, which he stated that knowledge and attitude will contribute mostly to the practice. So he stated that if the knowledge is high, so as the practice. For the health belief model, demographic variables and also psychological circumstances will contribute to the perceived susceptibility, severity, motivation, benefit and barriers, which will contribute to the actions to prevent any injuries that will occur due to the needle and stick, due to the poor practice of needle stick and sharp handling. So we proceed to the methodology. So the purpose of this study is the hypothesis testing, which is to identify whether the null hypothesis stated earlier in the study is significant or not. The research time frame is this study used a cross-sectional study and will be carried out from March 2020 until January 2021. Approximately collection of data will be obtained from May 2020 to December 2020. Quantitative study will be used in this type of study. The unit of analysis that will focus is the organizational, which are the nurses, and this study will give impact and also will contribute to the organization, which is the private hospital. And all nurses are involved in the studies, except for the nurses that are in the long leave or maternity leave. The sampling technique that will be used in this study is a simple random sampling, which is a a list name of the all nurses will be obtained from the human resources, and all the data will be entered in SPSS, and the selected respondent will be done through SPSS through the simple random sampling method. So the instrument that I will use in this study is adapted from Bhargava et al. 2013. This study which is done in India regarding knowledge and practice among nurses in the tertiary hospital. So they consist of 3 parts, which is part A, socio-demographic characteristic, which is I will include age, gender, education levels, and also year of services. Part 2 is a knowledge of the needle stick and sharp injuries, which consists of 13 questions that will include yes or no based questions. Whereas for part C is the 13th statement of the practice regarding needle stick and sharp injuries, in this part it consists of Likert scale scoring Likert scale method. Okay, so this is the sample size calculation that I will use in this study, which I take according to the Craigie and Morgan 1970. So approximately after I calculated using the Craigie and Morgan sample size equation, approximately I will need to achieve 205 participants as my sample size respondents. So this is the data collection process that I will do during this study, which is I will need to obtain the ethical approval from my university, which is Open University Malaysia, followed by ethical approval from KPJ, one of the private hospital, which is KPJ Penang Specialist Hospital, and need to be approved by the Chief Executive Officer CEO, and also Chief Nursing Officer CNO, and also the head of department of human resources, because I will need to obtain the list name of all nurses. And then a self-administered question will be distributed to the all nurses at all department through head of department, and instruction and also information sheet and concept form will be given to the respondent before they answering the question, and all the information will be handled confidentially. After respondents have done answering the question, the questionnaire will be collected by me and will be checked if the questionnaire has been answered completely by the respondent. So the conclusion of my presentation is needle and stick injuries are the major concern among healthcare workers, especially nurses, and this can be resulted due to poor awareness and also improper practice in handling needle and sharp. This study aims to determine the knowledge and practice among nurses, as well as the association between social demographic characteristic with knowledge and practice among nurses, and association between knowledge and practice among nurses, as followed by KAP model by Schwartz. A cross-sectional study design and a set of self-administered questionnaire will be used as the study instrument to measure the knowledge and practice among nurses. Descriptive statistic and chi-square test will be used to measure the association between the social demographic characteristic and knowledge and practice among nurses, as well as the association between knowledge and practice among nurses. So these are the different references that I use throughout this study. So that's all for my presentation for today. Thank you.